Which of the following would be considered appropriate in the treatment of a child with Lyme disease? A. Restricted fluid intake. B. A clear liquid diet. C. Contact precautions. D. Promotion of bed rest. E. Administration of antibiotics. The answer is E. Administration of antibiotics. Lyme disease is caused by the bacteria Borrelia burgdorferi. It is a vector-borne disease that is contracted secondary to the bite of an infected tick. Administration of antibiotics is crucial to recovery. Standard precautions are adequate. Restricting fluids, diet, or activity is not necessary. A mother calls the clinic because her son is 5 years of age and has been experiencing incontinence of diarrhea for 3 days. He has a past medical history of constipation. The physician has diagnosed the child with encephalitis. The nurse may recommend the family try which of the following? A. Restricting activity until the diarrhea goes away. B. Encouraging a low-fiber diet. C. Limiting sugary food consumption. D. Giving the child an enema. E. Taking calcium carbonate tablets. The answer is D. Giving the child an enema. Constipation is a common complaint in children. Encephalitis occurs when children are incontinent of fecal matter after toilet training. Often, a child will leak stools surrounding a large fecal mass that has hardened in the rectum. Giving a child an enema may help to clear the mass and restore bowel function. Constipation should be avoided through exercise, high-fiber diet, and adequate liquid ingestion. A school nurse examines a 5-year-old child who comes into the office with belly pain. The nurse palpates McBurney's point and the child winces and pulls her knees to her chest. The school nurse phones the parents to tell them which of the following? A. The child should be taken to the hospital immediately. B. The child may be experiencing reflux, spicy foods should be avoided. C. The child should be picked up and brought home. D. The child is likely constipated and will need to be seen in the office tomorrow. E. If the pain persists, make an appointment to see the physician later in the day. The answer is A. The child should be taken to the hospital immediately. Tenderness over McBurney's point, 1/3 the distance from the anterior superior iliac spine to the navel, may indicate appendicitis. This should be treated as a surgical emergency and the child should be taken to the emergency room. Other symptoms of appendicitis include nausea, vomiting, fever, and frequent soft stools. Rubella is a viral illness that commonly affects children. Which of the following is another name for rubella? A. Chickenpox. B. Measles. C. Fifth disease. D. Hand, foot, and mouth disease. E. German measles. The answer is E. German measles. All of the above are viral illnesses commonly found in children. Rubella may be referred to as German measles and is spread through droplets. The disease is generally mild, presenting with a rash that typically lasts around 3 days. Maternal rubella may spread to the fetus and cause severe complications. Rubeola, also known as measles, is highly contagious and is caused by the measles virus. Chickenpox is caused by the herpes zoster, varicella, virus. Hand-foot-mouth disease is a viral disease caused by Coxsackie virus A16. Fifth disease is caused by parvovirus B19 and presents with bright red rashes on the cheeks and other parts of the body. The nurse is caring for a 1-year-old male client who has been brought to the emergency room because his parents state that he has been more fussy than usual. He has current jelly stools and is vomiting. What may the nurse suspect? A. Intussusception. B. Umbilical hernia. C. Pyloric stenosis. D. Inguinal hernia. E. Incapricis. The answer is A. Intussusception. Intussusception occurs when a portion of the bowel is pushed into another portion. It most commonly affects children under the age of 2. Red currant jelly stools, stool mixed with blood and mucus, vomiting, and pain are common symptoms. Red currant jelly stools are a hallmark of intussusception. Pyloric stenosis generally causes reflux post-feeding, and incapricis affects children who have already been toilet trained. Hernias are rare in young patients. Incapricis refers to involuntary fecal soiling in children who are already toilet trained, and does not involve abnormal stool, such as currant jelly characterization.